Hello and welcome. Today we're diving deep in a condition affecting the urinary system, bladder diverticulitis. We'll explore what it is, what causes it, how it's diagnosed, and the available treatment options. So, let's get started. Bladder diverticulitis occurs when diverticula, which are small, pouch-like sacs, form in the bladder wall. When these pouches become inflamed or infected, we call it diverticulitis. The most common cause is prolonged bladder outlet obstruction, often due to benign prostatic hyperplasia, or BPH, in men. This obstruction increases pressure inside the bladder, weakening the bladder wall over time. Other potential causes include chronic urinary retention, neurogenic bladder dysfunction, where nerve damage affects bladder control, and rarely congenital abnormalities. Now let's delve into what actually happens inside the body. The initial high pressure within the bladder, most frequently a result of obstruction, leads to herniation of the bladder mucosa through the muscle layer. These herniations form the diverticula. Over time, these pouches can become filled with stagnant urine and debris, providing a breeding ground for bacteria. This can then lead to inflammation and infection, which is what we call diverticulitis. The inflammation can weaken the diverticular wall, potentially leading to complications. Bladder diverticulitis isn't extremely common, but its true prevalence is hard to determine. It tends to be seen more often in older men, particularly those with BPH. It's also more prevalent in individuals with neurogenic bladder or other conditions causing chronic urinary retention. Population-based studies on the exact incidence are limited, making it difficult to pinpoint precise numbers, but risk does increase with age and the presence of the predisposing factors we just mentioned. The symptoms of bladder diverticulitis can vary depending on the severity of the inflammation and infection. Some people might not experience any symptoms at all. However, common signs and symptoms include frequent urination, a persistent urge to urinate even after emptying the bladder, painful urination, lower abdominal pain or discomfort, blood in the urine, and cloudy or foul-smelling urine. In more severe cases, individuals may experience fever, chills, and flank pain, indicating a kidney infection that has spread from the bladder. Diagnosing bladder diverticulitis typically involves a combination of medical history, physical examination, and diagnostic tests. A urine analysis can identify infection by revealing the presence of bacteria and white blood cells. Imaging studies are crucial. A cystoscopy, where a small camera is inserted into the bladder, allows the doctor to directly visualize the diverticula. A CT scan or MRI can also be used to assess the size and location of the diverticula and to rule out other possible causes of the symptoms. Avoiding cystoscopy, which uses X-rays while urinating, can show the diverticula filling and emptying, providing valuable information about bladder function. While we don't typically classify bladder diverticulitis into distinct types, we can differentiate based on size, number, and whether it's congenital or acquired. Diverticula can be small and singular, or large and multiple. Congenital diverticula are present at birth, usually arising near the ureteral orifices, while acquired diverticula develop later in life due to the conditions we've already discussed. Treatment for bladder diverticulitis depends on the severity of symptoms and the underlying cause. Mild cases may be managed with antibiotics to treat the infection and medications to manage urinary symptoms. More severe or recurrent cases may require surgical intervention. Surgical options include diverticulectomy, which involves removing the diverticula. If bladder outlet obstruction is the underlying cause, addressing that obstruction, such as with a transurethral resection of the prostate or TURP for BPH, is crucial to prevent recurrence. In some instances, bladder reconstruction may be necessary. Preventing bladder diverticulitis focuses on managing the risk factors. Prompt treatment of BPH in men can help prevent bladder outlet obstruction. Maintaining good bladder habits, such as emptying the bladder regularly and completely, can reduce the risk of urinary retention. For individuals with neurogenic bladder, adhering to a bladder management plan recommended by their doctor is essential. Adequate hydration is also important to promote urinary health. The prognosis for bladder diverticulitis is generally good, especially when the underlying cause is addressed and the infection is treated promptly. However, if left untreated, complications such as recurrent urinary tract infections, bladder stones, and even bladder cancer can occur. Research is ongoing to explore less invasive surgical techniques for diverticulectomy and to better understand the genetic factors that may contribute to the development of bladder diverticula. Thank you for watching, and we hope this has been informative.